Welcome back to the Morning Blend. If you have any kind of foot pain, you know that it can be not only painful, but also debilitating. Today, we're going to show you advanced technology that can stomp out the pain. Stacy Roberts is back. She is the owner of New to You Health and Wellness, and today she's going to show us how to take a step in the right direction to get rid of foot pain. Hi, Stacy.
Hey, how are you doing, Molly?
I'm doing great. I know you're actually joined by a patient, Gail, too, right?
Yep. This is
Hi,
Gail.
good
Yep.
morning.
It's so nice to see both of you ladies. Thank you so much. I'm hoping you can talk about how common foot pain is, because I've had it more recently and it's terrible because you got to go places.
Exactly, and especially as the weather finally is getting to a point where we actually do want to go outside. Foot pain is so common because you can have plantar fasciitis, which we've talked about before on the show. You can have arthritis in the joints. You can have situations like what Gail has had post-surgical and still having pain after surgery. So it's so common. Everybody at some point in time will experience foot pain.
Yeah, and everybody will not like it when they have it. So let's talk about, we mentioned advanced technology. You actually have a soft wave treatment, right?
Correct. Yep. So Softwave device is a type of shockwave device, and we'll show you that in a little bit in the live demonstration. And basically what that does is it penetrates deep into the tissue, helps decrease inflammation, increase blood flow, and that promotes healing.
That makes sense to me, because inflammation is something very common, I think, especially as it involves not only the foot, but the ankle too. And so, Gail, I'd love to know about your experience with this soft wave therapy at New You Health and Wellness.
Well, I had foot surgery about 6 years ago, and I ended up with having stiffness in my big toe, my second and my third toe, and my foot actually didn't function really as a foot. So when I would walk, it would be more like a flipper. And I actually saw Stacy on the Morning Blend, and I looked at it, and I know she was doing plantar fasciitis, and I contacted her, and I came in, and this is my 5th treatment today, and I'm feeling absolutely fabulous. I have mobility and more mobility in my foot and my toes. I can feel sensation at the end of my toes, and on the bottom, I had a lot of scar tissue, which was like hard as a rock. And now that is all soft, and my foot functions more like a foot. I have more stamina, more strength in my foot, and it has made a world of difference for me.
It's so
the other day, she was at the Bucks game, and she was outpacing everybody that she was walking with, or she used to be behind, and now she's in front of everybody.
I love it. And I love that you're wearing that T-shirt with the headband. That's so fantastic. Has it changed your life, Gail, to be able to walk without the pain?
Oh, definitely. And just to have a foot that functions as a foot. And I think the difference also has been that my other foot, it kind of took a beating because the other foot wasn't working. And now both of my feet are working as a team, and I can walk so much better, and I have much more stamina and can do a lot more things.
Love hearing that. Okay, so Stacy, do a little demonstration if you could. Tell us a little bit more about how it works.
Absolutely. So let me bring you a little closer here so you can see what's going on.
Okay, Gail's going to be your patient today.
Yep. It's getting a good one in here. So this is the Softwave device that you've seen before. And what happens here is there's water inside this dome. Okay. And when I click on it, there's an electrode. You can see the light flashing in there, and that's the electricity that's coming out of there. So basically what's happening is that electricity is pushing through the water, and then when it goes up against the body, it penetrates into the body, and that wave that goes in there helps decrease the inflammation, which decreases the pain. So I'll show you what it looks like right on Gail's foot when we do it.
And tell us too if it hurts. Do people say it hurts?
So it's usually they describe it as a good hurt. There's kind of a sensitivity over different areas. Depending on where there's inflammation, it will actually feel like it's like a slight rubber band coming up against the skin.
Okay.
And then the deeper it goes, it's kind of like when you get a really good massage, and it's a good hurt.
Okay.
So I'll go ahead and turn it on. It's a little bit loud, so I won't be able to talk over that.
No problem.
If it goes. There it goes. I don't know if you can hear that or see it. Turn it this way. It's probably a little bit better.
Yep, I can absolutely see it.
You doing okay?
Yeah, doing fine.
Yeah. Great. So I go right along the foot, you can see some of the scarring on Gail's foot is where we concentrate. That was really hard tissue that we really wanted to break up so that she had more comfort and more mobility in that foot.
Gail's saying, yeah, give me the Softwave because I can walk now and my foot functions the way it's supposed to. That's fantastic that you were able to do that demonstration for us, Stacy. I really appreciate that. I'm wondering how many treatments it takes for most people to get relief or to get that function back in their feet.
They should get relief the first treatment walking out the door. And I think that was true
Definitely.
for Gail as well too. And then progressively that pain starts to stay away for longer and longer periods of time. Gail was telling me yesterday she was raking with her brother and raked about, what, 12 bags? 12 bags of leaves and things from the garden. So, and that was, I mean, there's no way she could have done that when I saw her, you know, the first day.
That's just absolutely wonderful. Gail, thank you so much for joining us. I can see you there. You were a fantastic patient today. I'm so excited to hear that you have reduced your pain so much. I got to make an appointment now, Stacy.
And welcome back. Well, I've said often on the show that my Aunt Dolly told me once, if you do anything, take care of your feet. Living with foot and ankle pain makes being active nearly impossible. So it's something we all got to do. And here to help you decrease pain and swelling to accelerate healing and get you back on your feet is physical therapist Stacy Roberts with New You Health and Wellness and their happy client, Kayla Pipo. Good morning to you both.
Hey, good morning.
Good morning.
Thanks for joining me. It's so true, right? We got to take care of our feet.
Totally.
Absolutely.
They go everywhere with us.
Absolutely. We can't change them out. So I want to start with you, Kayla, and talk a little bit about your experience and exactly what you what was going on with your foot or with your ankle that led you to going in to seeing a New You Health.
Yeah, so I had classic leaving the house, missed a step and crunched down on my ankle, felt excruciating pain, and then tried to do the right thing, staying off it, icing it, doing some exercises, but probably not nearly as much as I should have been avoiding use. So then it was about 2 months later when I still was just noticing really limited range of motion, a lot of pain, even on kind of short walks. So that's when I figured I should probably do something a little bit more.
I think a lot of people are going to resonate with that. And just obviously these before and after pictures are great, but just that walking with pain, consistently feeling pain every time you're walking. So I think that obviously you were like, okay, now's the time I have to do something. So how many treatments did you have to do? And were you then pain-free?
I only came a couple times and it was amazing, even just after the first visit, how much visually you could notice and then being able to just walk on it. Yeah, my range of motion, how far I could move my ankle, and the pain was completely gone after the second time. So it was pretty wild.
That's awesome. Obviously, we're seeing you here in Peru. So you went hiking. Did you do Machu Picchu?
I did.
I'm so jealous. That's my bucket list trip.
Yeah, it was awesome. And I was hiking, you know, for hours a day. So definitely needed to have that ankle in shape.
Did it come back? Did the pain come back?
No, not at all.
See, that's amazing. Stacy, you got to talk about what did you see with her ankle? Because a lot of people have done that. They've just stepped on a step wrong. They've done something like that and they've had swelling or pain. What did you guys do to fix her pain?
So basically what we did is we got the inflammation down, and we did that with our Softwave device. That's the electrohydraulic shockwave device that I use for most joint and muscle pain. So that decreased the swelling. Then we did some stretches. And then when she iced after that and took care of it, then she was able to get the benefits from all of those things that she was doing. Before, the swelling was impeding her from getting that and causing her more pain. So we wanted to decrease that inflammation and then eliminate it so that she was able to be more functional and have more mobility.
So a lot of people will just take like an inflammation reducer, like a Advil, Tylenol, Aleve. Why are those things not working the same way as something like Softwave to get rid of that true inflammation?
Great question. Those things don't necessarily get rid of the inflammation, but they decrease it. But they don't address the reason why the inflammation is there. So when Kayla was continuing to walk on it, it just continually got irritated and more inflammation came in. So you take an anti-inflammatory that decreases it a little bit, but you keep walking, you keep on it, so it keeps increasing. And then you just have to continue to take these anti-inflammatories, but you're not getting to the underlying cause. So with the Softwave device, what's doing is promoting train the body's own innate healing process to go in there with anti-inflammatory molecules that your body already makes itself and decreases the inflammation. And it just happens so fast. It's pretty amazing.
That is amazing. I got to ask you, how long do you often hear people having had lived with this pain or swelling before they actually do something about it? Because I think this is one of those things people just sort of think, oh, it'll go away, and they live with it way too long.
Absolutely. It could be, a couple months, or I've seen people a couple years that are having issues or longer, and then they just say, nothing has worked. I've tried physical therapy. I've tried, exercises. I've tried ice. All these things weren't working for them. But then when they hear something different, something unique, like the Softwave device that we have, they come in and try it and finally get relief. And I'm so excited after 30 years of being a physical therapist to be able to, give this type of relief to people that even sometimes I wasn't able to help before.
So true. You're right in front of the machine, which I think is wonderful. It's very small. It's simple to use. Kayla, does it hurt? Do you feel it?
It's like a slight shock, and then she kind of sees how far I can tolerate, goes right up to the edge of that. And then once it's in an area for a while, then it stops hurting.
Huh. That's wild. Okay. And it basically looks like it gives little electrical pulses.
Yep. So if you grab it here, here's the applicator, and this is called an electrohydraulic shockwave device, meaning there's water inside there within a little electrode. And if you can see I don't know if you can see.
Oh yeah, we saw that.
Yep. So there's a little, there you go. There's a little shock waves coming from that device. And then once it comes against the skin, what happens is that penetrates as a wave and it flushes over the area that's injured. And when you hit a spot of inflammation, you will feel sensitivity, but it's able to be controlled so that the person isn't in excruciating pain. People tell me what they tolerate, and then they're the boss. So I listen to them.
I love it. All right.
Today, a very personal problem for women. It's pelvic pain with intercourse. Our next guest says it's common, but you do not have to live with it. Stacey Roberts is the owner of New You Health and Wellness. She is here with help. Hi, Stacey.
Hey, Molly. Good to see you.
Good to see you, too. Do you find that a lot of women are reluctant to talk about this subject?
Men and women, but especially today we're talking about women in chronic pelvic pain, and specifically with intercourse. It can be something that many women just take as normal, right? But even though it's common, up to 20% of population for women would experience it, or at least chronic pelvic pain. And up to 40% at one particular primary care clinic of women had chronic pelvic pain and some related to intercourse. So we just think it's normal, so we don't talk about it. And if there's no treatment for it, then, people just shrug their shoulders and just live with it.
Yeah, I was just going to ask, I bet by the point that you talk to people and they're doing something about it, they're at a point where they're like, oh, I thought this was something I just had to live with.
Exactly, 100%. And those who have doctors who are more aware of what's available, we'll potentially send them to physical therapy, which is fantastic. There's a lot of really good pelvic floor specialists that can help. But in our case, sometimes that doesn't help completely. And we had a situation where we had a young woman who had been married for, 8 or 9 years, and she was having pain, so much pain with intercourse that she stopped having intercourse over the last 5 years of her marriage. And it just obviously became an issue with her marriage. Although they stayed together, it was still a contentious issue. And she had physical therapy and then came to me, and by a good physical therapist too, and then came to me and we did the shockwave treatment along with other physical therapy. And it was miraculously, really, in 3 treatments, she had absolutely no pain. Really, after the second treatment, she had no pain, but we both were a little bit nervous to say whether it actually would have worked that quickly. So she had 3 treatments, no pain, and I spoke to her, and it's been 4 or 5 months since she's had any pain. So it's just been fantastic.
That must be so encouraging for everyone out there who's listening to you right now, who thought that they were in that category where they just had to live with it and they're experiencing so much pain that they're avoiding it altogether. Before we get to more about the treatment, what causes this type of pelvic pain?
It can be caused by many different things. Hormonal changes can be one. In this particular incident, the woman had an IUD inserted years ago, and shortly after that, she started to have the pain. We don't know if that was directly the issue, but it was around the same time. So there could have been also a hormonal shift that contributed. And then once it started to hurt, unconsciously, you kind of tighten up in the pelvic floor. If you guys remember that down in the pelvic floor here, there's a ton of muscles in that area. So that can contract and then just not let go and make it very difficult for intercourse at all. Other things could be sexual trauma in their past, or trauma to the area through surgeries, or chronic pelvic pain from period pain issues. So there's a lot of different things that can go into it.
So tell us again about this treatment. This is so exciting, especially for the woman that you mentioned that got so much better after 2 treatments and for sure by 3. How is it different maybe from regular physical therapy or whatever other doctors might be using to try to treat the problem?
Absolutely. So there's some doctors who will try to utilize medication for the issue. And if that doesn't work, they may send them to physical therapy. And then a pelvic floor physical therapist oftentimes does an internal check to see what muscles are being effective. And then they'll give them some exercises and utilize something called biofeedback at some points. And if the muscles are really, really tight, then they'll use something called dilators to help stretch the muscles out in that area. And that was all done. And again, that can work for some people, but it worked for about 3 or 4 months after 3 or 4 weeks after she had that treatment for 8 weeks time. But then it came right back gradually over a period of time. Whereas now she's been away without pain for almost 4 or 5 months now, which has been fantastic. So what's different about this is it penetrates deeply into these muscle structures. So this is the only modality that I've ever seen that penetrates to the depth of like a soup can without causing any physiological damage. It brings blood flow to the area where these muscles are red, they're full of blood. So it brings increased blood flow to that area, which allows the treatment that I do manually to be able to work and be much more effective. And then along with those exercises that she was already taught, we combined all that together and she's had a fantastic result.
It's incredible. I have a testimonial right here from JM of Milwaukee to protect privacy. You can see the full quote there on your screen, but it's incredible that she says after seeing you, Stacy, she learned about the software technology. She was amazed, she said, at the progress after just a few short sessions that's been maintained over time with no regression. I think that's so important. She said she's gotten to the point where no pain exists with intercourse, and she's so happy to have found you at New You, which that just must make you feel so good that people are really having such incredible improvement.
It's something, I've been a physical therapist for 30 years, Molly, and I have not seen this type of improvement with a modality ever in my years as a physical therapist. So every day I'm excited, whether I'm treating a shoulder, a knee, a back, men for erectile dysfunction, any type of pelvic pain. I'm just so excited because this is something that I truly haven't seen be this effective, this quickly in the many years that I've been practicing.
And truly life-changing and relationship-changing. We ran out of time, but very quickly I want to ask if it's painful, if the treatment that we're talking about is painful.
Absolutely not. As a matter of fact, if they have pain with the treatment, we refer them out to see what potentially is causing the pain, because this treatment is absolutely not painful when it is used correctly. And on the area, when we're talking about pelvic pain, musculoskeletal can be a little bit uncomfortable, but if there's pelvic issues or erectile dysfunction, absolutely no pain with treatment.
That's so important to know. Thank you so much, Stacy. So encouraging.
Thank you, Molly.
Welcome back. Well, we know this next subject is a difficult one to talk about, but erectile dysfunction can be devastating for men and for their relationships. Many men don't seek treatment because it's too embarrassing. So today, we've got details about a holistic approach to help with ED. Joining me now is Stacy Roberts. She is the owner of New You Health and Wellness with information about this non-invasive technology, which I think is going to sound good to people. Hi, Stacy.
Hey, Tiffany, good to see you again.
Absolutely, you too. You know, I think this is a tough topic for people to talk about. It's embarrassing. You don't want to admit that there's an issue. And then sometimes women, we feel like potentially it's our fault or we're not attractive. There's a lot of things that go into it. What is erectile dysfunction?
Well, as most people know, erectile dysfunction is the inability to have an erection or maintain an erection. So, but what people don't know, Tiffany, is how prevalent it is. even above the age of 40, 45 to 50% of men have actually experienced some sort of erectile dysfunction. And that percentage then goes up as men age. So like you said, they usually don't talk about it much. They're certainly not going to be talking to their buddies about it. And it can even be uncomfortable with their spouse. So we really want to bring in some, just some focus on how to help both the male and the female and grow and improve that relationship as a result of addressing it.
Yeah, because it's nobody's fault. There can be a lot of different things going on. It potentially is a blood issue, right? So are you by the machine that you use? How does the treatment work?
Yep, so there's a holistic approach. So the machine is part of the treatment, and I'll talk a little bit about what the machine does, but then I want to also go into what the rest of the holistic approach is. But the non-invasive approach would be this machine. It's a type of shockwave therapy. There's a lot of different shockwave therapy devices out there. And in the ebook that I have available for people to download after the segment, they can find out the questions to ask if they're going for some sort of ED treatment that's not with their urologist, that they can ask to make sure that it's actually true shockwave like this machine here. Thankfully, we're only one of 3 in the whole state of Wisconsin that have this. We're in the Milwaukee area. But how it works basically with this machine is it has been shown to bring more blood flow to the area. So really the technology, if you remember it from the last segment, it performs some shocks through water here. So basically what happens is we put this up against the genitals and there's absolutely no pain whatsoever. I know it can be kind of scary to see this coming at you, especially in those sensitive areas, but there's absolutely no pain or sensitivity whatsoever in that area. And what happens is over time, research has shown that blood vessels will actually grow. There'll be more blood vessels in that area over a period of time, so that there'll be more blood available to the penis to help to maintain that erection and create an erection. But that's not all, Tiffany, because you need more than just increased blood flow. You need something called nitric oxide. So nitric oxide is really important to relax the smooth muscles in the penis so the blood can get in there. So if all you're doing is taking supplements to increase blood flow, you're really not addressing the whole issue from a physiological perspective. And then when we have physical therapy, what happens with physical therapy, I mean, when you think of physical therapy, you think of shoulders, knees, plantar fasciitis, like we've talked about before. But really, physical therapy works with muscles and joints, right?
Yeah.
So this is the bottom of a pelvis, okay? So this is the bottom of the pelvis, and this red stuff is all muscles. Okay, so this is both males and females. So working on the pelvic floor is extremely important for both men and women with issues with painful intercourse as well, but specifically to erectile dysfunction. These muscles have to maintain how to hold up the penis as well. So it's like a muscle like any other. If it's not being used because there's an erectile dysfunction issue, it's not being used, then it gets weaker. Right, so we need to be able to know exercises and teach people exercises to improve the pelvic floor strength, but also for men, there's something called tone. A lot of times men have high tone in those muscles, and there's specific exercises to do to release that tone so those muscles can work in the best way possible.
See, I think this sounds awesome to people listening, because a lot of women have heard, like you said, about this pelvic floor and strengthening those muscles for, like you said, painful intercourse, urinary incontinence, all those things, orgasms. I mean, so to know that it's the same in men and women and you can work with that is pretty incredible. I know that this is long lasting, right? Because a lot of people will say, well, is this just a short-lived therapy? But this is something that can actually, like you said, grow those blood vessels and help long term.
Absolutely. And also what's good about our program is you're not just getting this and leaving. We're also talking about what else to do to make this a long-term solution so that you can not only just get the treatment and have, effects shortly thereafter, but also, as you said, you don't want to be thinking you're going to have to come to this, every week for the rest of your life, right?
Yeah.
So we want to have some long-term solutions. So we talk about different things like nutrition. We talk about decreasing some inflammatory foods in the diet that have been shown to affect that nitric oxide. Things that decrease blood flow. We want to increase blood flow. So it's a holistic program that's part of the shockwave therapy. And one thing that's really unique about this device too, Tiffany, is that because of this specific probe here, this can penetrate deep into the tissues, like about 4 inches. Some of the other shockwave devices, they're called shockwave, they're not really shockwave. Some of the other shockwave devices out there only penetrate, let's say about, maybe a stack of five nickels, whereas this gets deep into the tissue. So this can get into the pelvic floor, which is also important because then the spinal nerves that come out of the pelvis, or excuse me, out of the spine and innervate the pelvis can also be affected with erectile dysfunction. So we can get at those nerves as well with this machine.
Welcome back. Well, you don't always realize how much you need your knee, right? Until something goes wrong. Well, joining us now is physical therapist Stacy Roberts. She is the owner of New You Health and Wellness, and recently she hurt her own knee. Good morning to you, Stacy.
Hey, Tiffany, so good to see you.
Good to see you too. What happened? You hurt your own knee as well?
Yes, it was crazy. It was a family wedding that I went to, and my son, who's 23, was attempting to polka. And I was like, I wanted to put him out of his misery and teach him how to actually polka. So I got up there and we were dancing to the beer barrel polka, and I heard this massive pop in my knee, and I had searing pain. And he made me finish the polka, but after that, I basically dragged myself off the dance floor and couldn't put any weight on it. It swelled up like a balloon.
Oh my gosh. I'm telling you, anybody who's had that experience knows exactly what you're talking about. They've heard the pop, they've felt the pain, they've seen the swelling, all of that. So when that happened, what did the doctor say? Because you went in, obviously, after that, saw a doctor, and tell us a little bit about that.
Well, they basically told me after looking at my knee that I had torn both of my meniscus. So if this is your knee, okay, there's meniscus in the middle here or on each side. They said I tore both of the meniscus, and I also sprained a ligament in the back of the knee as well too, all from the beer barrel polka. Who knew that was so dangerous? And they were recommending that the only thing that I could do were injections, cortisone injections, or have a knee replacement. And I was like, what? It wasn't hurting before that. So obviously I turned to our technology, the Softwave technology, the only true shockwave in the Milwaukee area. And I was even stunned at the results.
Okay, so talk a little bit about this. It was several treatments, and this is electrohydraulic shockwave, right?
Very good.
Yeah, I was like, wait, I got to read this, right? So what is this technology? Because I'm thinking, is this like electric and water? What is it?
Yep. So basically inside this applicator here, there's water. So you got that right, hydraulic. And then there's a little electrode in there. Okay. And then basically we use it and it flashes, and that flash is the electrode emitting energy through that water. When we put it up against our body, that turns into something called an acoustic wave, which then dives deep into the tissues. And this is the only true shockwave device in Milwaukee that can go up to 4 to 6 inches. So on my knee, and particularly, it was able to go right into the joint where those tissues were injured, where most of the modalities out there today really just go a couple millimeters underneath the skin. And you can see on my x-ray there, that's basically showing my good side and my bad side there and the areas where I had what's called osteophytes or bone spurs, and a narrowing of the joint line, which is why the doctors were saying that I was going to need a knee replacement. And I'm like, yeah, that's not going to happen at this point.
So what do those deep shock waves do? Are they healing the meniscus? Are they addressing the bone? What is the actual thing that it's doing?
Great question.
Because after two treatments, you were able to walk without crutches.
Right. After one treatment, I was able to still walk without crutches, with a little limp. And then this is showing me, like, this is the morning after, and I really couldn't put any weight on. Then with treatment, what it's doing is it's decreasing inflammation. This is right after treatment. I was able to put more weight on it and walk a little bit more upright. That's after the very first treatment.
Wow.
So it's pumping out the inflammation out of there, which is allowing the body to then go in there and help to heal the tissues. Now, my meniscus aren't going to be miraculously back to normal, but it got to the point where the inflammation was down enough that I could start walking on it. And then in physical therapy, build up the muscles around that and do my stretches, things like that. But without this, I couldn't have done those things as soon as I did. And this is after the second treatment where I'm walking basically without a limp. I still can't balance quite as well on that side as I would like to. And I love my black sock over there on the other side. After the third treatment, I was walking normally and able to balance like I would normally do. And again, I was even surprised at this technology. And this is after the third treatment. I was taping my foot to give my arch a little bit of support, which also helps your knees. And you can see that I'm able to balance much better on that side as well too.
Wow.
So, yeah.
You know, Stacey, I think people are going to see that and they're going to say that's, I mean, obviously that's incredible that you're able to do that. They're going to, what I want to know is if you continue to do that, could it re-injure it? Do you still have to have that meniscus like sewn together, or what is the prognosis after something like this?
Sure. So if the meniscus is not catching your knee. So for example, if I was straightening my knee and I couldn't straighten it anymore because that meniscus was folded over or stuck in there, then usually people need to go in for surgery. But if the meniscus is damaged and there's inflammation around there, if you pump out the inflammation and you build up the strength of the muscle and work on flexibility, and then you work on hip strength and the position of the foot, you can take the pressure off the knee so you don't have pain. So I can walk, and I don't run anymore, but I do my walking 3 to 5 miles, and I don't have any pain in my knee anymore at all because of decreased inflammation and strength and flexibility that I have in that leg. So many people are told they've got to go right to surgery, and that's not necessarily true.
Wow. I think this is going to just shock people, Stacey. I know they're going to want to come in and meet with you. And welcome back. Well, plantar fasciitis is the type of foot and heel pain that tends to hang around for a very long time. But today, we're going to introduce you to a new treatment to get relief much faster than before. So joining us now is Stacey Roberts from New You Health and Wellness, along with one of her very happy clients, is Nisha Gandhi. Good morning, ladies.
Good morning, Tiffany.
Thanks for joining me today. I'm so excited about this because I am not kidding you. Everyone I know has plantar fasciitis. They've got pain in their feet and they just cannot get it to go away. So can you explain first, Stacey, what plantar fasciitis is?
Sure, absolutely. We're practicing a social distancing, so Nisha's going to step away a little bit. So just wanted to show you here. This is the bottom of a foot. And this white stuff here, which covers the red, which is the muscle, that's the fascia on the bottom of the foot. So when that's irritated, like either from a bone spur or irritation at the bottom of the heel, you see that red spot there? That fascia can become inflamed, and that causes significant heel pain, as well as pain up and sometimes up into the lower leg as well. So Nisha can talk all about what she experienced with that plantar fasciitis for sure.
Well, okay, let's go to you, Nisha, then, and let's talk about this. So you were at a point, right, that you were limping. You could barely even walk on your foot.
Yes, that's correct, Tiffany. I actually called Stacey and said I could really put pressure on my foot. She said, come on in. And within the first day, I was walking normally after my first treatment. So super exciting stuff.
Wow. Okay, I know the progression is pretty incredible. Not only were you walking after the first day, but then you were walking 2.5 miles after 3 sessions and running 2 to 3 miles after 5 visits. And I know when people think that, they're thinking to themselves, my foot, that won't happen to me. But that truly is how your progression went, right?
That's absolutely correct. I am very skeptical of therapy, but they did a great job, kept me committed, gave me some fantastic stretching exercise, continued to help me think through nutrition, the therapy from the machine. I did that once a week. We targeted specific areas on my foot, and I am currently running 3 to 4 miles a day, 3 to 4 times a week, and feeling great. It's helped with knee pain and hip pain as well. So the machine and the therapy that Stacey's team has provided has been amazing.
And this machine, Stacey, is called Softwave Therapy. You are you the only one, right, in the Milwaukee area that has this?
Yep, I'm the only one in the Milwaukee area that has this Softwave. It's been around for about 15 or 20 years. Really just starting to see it come into therapy, into physical therapy as a therapeutic treatment. And I've been a manual therapist in physical therapy for 30 years. And I rarely, if I use modalities, when I saw the results that we were getting from this machine, I was blown away. So do you want us to go ahead and do a demonstration so your viewers can see?
Yeah, do it, because I know it's kind of got a clicking noise, so you can't do it for very long. So I want you to run it and kind of walk us through as you demonstrate exactly what it's doing and if it hurts.
So this is the applicator of the machine. You look inside there, there's this area here is like a squishy ball of water. And there's a little like spark plug inside that machine that creates a little electrical spark. So what happens when I turn it on, we get some sparks. Of course, this is live, so we're not gonna.
Yeah, we can hear that. We can hear it sort of clicking and sparking. We see the sparks too.
The sparks happening. So That's sending an electrical signal through the water. And you can see it's getting stronger now. And then that is making an acoustic wave go through the skin, which then helps to bring more anti-inflammatory substances to the area. So it decreases inflammation. And then when I combine that together with the soft tissue work that I do as a physical therapist, it's been creating some significant results. So do you want to see the whole treatment?
Yeah, go ahead, please.
Awesome. So we put the gel on as a conducting agent. Some people who've had ultrasound before may have seen that. We put that on as a conducting agent and then keep it from falling off the heel, obviously. And then we move that away. And up and down. And push up here a little bit harder. When we go through the area that I showed you on the picture, that can be painful. How are you feeling with that, Nisha? Okay? Good. Excellent. Any pain at all? A little bit. Okay. So usually when I'm with a patient, then I'll ask them what level of pain, 0 to 10. What would you be feeling with that? 1 or 2. Okay. Excellent. So we can go up to a certain level of feeling for this to that shows me that she's getting a good therapeutic treatment with it. So that's basically the treatment. It lasts usually anywhere between 10 and 15 minutes. And then we do the soft tissue work. I go through the exercise program, and then we talk about how she can, her footwear, how she can, change things for running better, for walking better. So you don't have to be an athlete to have this treatment. It can be for anybody that's having this type of heel pain or even foot pain. What's nice about this is any musculoskeletal issue that you have, even pelvic health issues, any joint issues, this machine has been shown to be able to be really significant in a person's recovery. I'm really excited to have it.
I'm excited that you have it too, because I think about the people who have plantar fasciitis and just how painful it is. And once you start walking with a limp, we know then it starts affecting your hips and it starts affecting your whole body alignment. And I'm sure that's what you see is if people let this go too long, they're going to end up with back, with hip, with other joint problems that they could avoid, even knee issues, I'm sure, if they're favoring one side or the other.
Yeah, absolutely. And what happens often is some people will have knee pain, hip pain, and that actually can contribute to developing the plantar fasciitis. So oftentimes we'll be working not just with the heel and the foot, we're working up the whole chain. So we're looking at what's happening at the knee, what's happening at the hip, because that can affect how they're walking and running. So a lot of my patients, I would say over 50 to 70%, would have some other type of issue. Nisha had some chronic hip pain for over 10 years, was it?
Mm-hmm.
Yep.
Correct.
Yep. And now that hip pain is, what would you say?
It's reduced. I don't suffer from it.
Okay. So we worked on her hip as well as her foot, and then we also are working on her knee and some good stretching and strengthening exercises. So again, she's back to where she was before with less pain than what she had before, which is absolutely fantastic.
You guys, Stacy and Nisha, thank you so much for sharing this.
If you have pain in your shoulder, it could come from a variety of different causes. Whether you were in an accident or you just reached something the wrong way, reached for something, our next guest has a new therapy that could relieve your suffering. Joining us now from New You Health and Wellness is the owner, Stacy Roberts, along with one of her patients, Pam. Good morning to both of you.
Good morning.
Good morning. I feel like shoulder pain is so common. You hear so many people talking about it. Can you talk about the types of shoulder pain that you see, Stacy?
Absolutely. So the shoulder is an interesting joint because it's a ball and socket joint. So you've got this ball stuck in the socket, and there's a lot of mobility in the joint. So because of that mobility, there's a lot of chance for injury. But one of the interesting things that we see in the clinic is especially women who are either perimenopausal or menopausal tend to have an increased level of shoulder pain, and that could be due to the estrogen levels decreasing. Because around this ball and socket joint, there's also something called a capsule, which is like a balloon. And sometimes if there's a minor injury or, again, hormonal changes, that capsule can shrink a little bit and make it more difficult. And then you get an impingement in the shoulder. So you get pain here, or it refers down here, or sometimes it goes up into the neck. And then all of a sudden you're limited in, reaching up overhead, trying to get your bra on in the morning, trying to wash your hair. And you start noticing these things happening that start to get worse and worse. So by adjusting that, doing some manual therapy on that capsule, and then utilizing the shockwave that we have here, we've seen some tremendous improvement with patients.
So happy to hear that. And I want to talk about the treatment in just a second. But Pam, first, if you'd share your experience and the type of pain you were having in your shoulder.
So it's in my left shoulder, but I just, over a couple of weeks, all of a sudden I couldn't raise my arm up without having pain, and I'd have tingling down my arm, or I couldn't put my coat on because I couldn't reach my arm back far enough. So, and it just kind of kept getting worse. No matter how much stretching I did, no matter what I did at home, it just didn't fix it. So I've seen Stacy for other things, so I figured, let's see what she can do for my shoulder too.
Yeah, I'd love to know more about that, Pam, because I understand that you did the Softwave therapy as well as the manual hands-on therapy. Did you feel it was a combination of those things that helped you get relief?
It is. It really is. The shockwave gets really deep inside to your muscles, and that just loosens them up in order to relax them. So that way, when Stacy does her manipulation and does the stretching on your arms, it just increases that ability to pull it out farther and to get it to stretch out the way that she wants it to.
So how's the pain now, Pam? Have you noticed significant relief and significant reduction in your symptoms?
Yes. Before I could just barely raise my arm to maybe here. Now I can raise it all the way up to here without it clunking or having any pain. So
that's such good news. Talk to us a little bit, Stacy, about the technology you used and how you used it in combination with manual therapy.
So the technology is the shockwave technology, which you've seen before. And basically, let me grab it here. It's from a company called Softwave, and there's a little electrode inside of this water here that when I press it, you get electricity that's pushing energy into the joint. Now, most modalities that you use only go on the surface of the shoulder joint, but this can get directly through that capsule into the shoulder joint. So that, like Pam said, when I'm doing the mobilization on her shoulder, I can really stretch that capsule out where I can't get that same thing with other modalities. It takes twice as long or 3 times as long to get the results that we get in 3 to 4 sessions. So it's been, for me, a game changer after being a therapist for 30 years, being able to apply this technology to get my patients better faster.
So then you do this, it penetrates a little bit deeper, you get that energy there, then you combine that with the manual therapy?
Right. So what shockwave does helps to decrease the inflammation. And then we do some manual therapy to stretch out that capsule. And then we re-educate the muscles basically on how to move. So if there's a rotator cuff weakness or even a rotator cuff tear, we help to improve the healing of that rotator cuff tear. But in Pam's case, there was no tear, there was an impingement. What was happening is that capsule got so tight that when she was raising up her arm, it was smashing against another bone. And then there's some tendons in there that get pinched. So there's an impingement syndrome, inflammation happens. Shockwave can decrease that inflammation. The mobilization that I do helps to stretch out that capsule, and then retraining of the muscles shows the arm how to move again without pain.
Wonderful. And can you tell by examining it, someone's shoulder, if they'd be a good candidate for this?
Absolutely. So I can, when they come in, like I said, having done this for so many years, I pretty much can tell, is this a rotator cuff tear that I'm going to need to refer out to a physician? Or is this a chronic issue over time that's from an impingement? Or is this potentially coming from the neck? Because some shoulder problems can come from the neck. So with an evaluation, we can narrow down the specific issue and then decide whether the treatment will work for them, or if they need to see like an orthopedic surgeon, which most of the time the orthopedic surgeons are sending me the patients because they're just not getting better, or people are coming in after they've had another physical therapy or chiropractic appointment and they're not getting the relief that they want. So that's when they're coming to see me as well.
Wonderful. Stacy, thank you so much. And Pam, congratulations on the reduction in your symptoms. It was wonderful to hear your story. If you've ever suffered from neck and shoulder pain, you know it can be debilitating. So today, a treatment that can decrease pain and discomfort. Stacy Roberts is the owner of New You Health and Wellness, where this advanced Softwave technology is offering pain relief. She is joined by her patient, Linda Walsh. Good morning, ladies.
Good morning.
Good morning.
Good to see you guys. Good to see you, Molly.
Good to see you too. And Linda, I want to start by asking you, how long were you having neck and shoulder pain before you visited Stacy?
I started having terrible neck tightness and shoulder pain for many months, probably at least 6 months.
That's a long time to have pain like that. How is it affecting your life? I'm interested in knowing if it caused sleep problems for you or just getting things done as you normally would throughout the day.
Yeah, I think the sleep was the hardest part. I had troubles falling asleep because I couldn't get into a comfortable position. I couldn't turn my head on either side when I was sleeping because of the pain that I was feeling. I also had trouble at work, like sitting at my desk all day, typing on the computer. I just had constant pain, throbbing, and the tightness was really bad.
Yeah, I feel like with things like that, chronic pain, it's just no way to live. How long, so you started these treatments, how long was it before you noticed relief?
Well, this is pretty amazing. I had my first treatment, and 2 days after the very first treatment, I was able to sleep comfortably and also work well. So the pain was eliminated right away.
Wow.
So, yeah, it was amazing.
Did you think after suffering for that long that you could actually be pain-free?
I didn't, because I tried several other things. I had deep tissue massage. I would try to rearrange my work desk, try to eliminate it, doing yoga, doing exercises, and coming to New You, I thought it would take, several treatments, if anything at all. And it was the best thing ever when I could turn on my side and sleep after 2 days after the very first treatment. It was amazing.
Good for you, Linda. Amazing to think after just one treatment. And Stacey, I wonder how often you hear this from people, that they're frustrated with trying lots of different things, maybe even lots of different therapies and treatments, trying to get some relief before they see you.
Absolutely. That's really where this technology shines. When everything else conventionally isn't working, this technology, the Softwave technology, which is a form of shockwave, gets deeper than most modalities can get in other more conventional treatments. So it's very, very common. And we don't see this happen every single time, one treatment and they're done. I was even amazed at that when Linda talked ahead of time. We talked about it probably will be about 3 or 4 treatments. Yeah. So that's normally what we see where people get significant relief. But yeah, it's very common with chronic pain to be suffering for that long and just be frustrated that there's nothing out there when there actually are some really good modalities like our Softwave technology.
So tell us, so it's called Softwave technology. How does it help joints and muscles?
Sure. So here, this applicator is how it's applied. So basically there's a type of shock wave that comes through the applicator. It's applied to the skin, and once it gets to the skin, it goes deep into the tissues to either, if it's a muscle, like in Linda's case, she had some muscle tightness and some joint issues. So we were able to get more blood flow to the muscle to relax that muscle. And then we were able to get into in between the joints, so that when I did my manual therapy, I was able to correct the issues with her joints more easily than I would have without utilizing the technology of shockwave.
When you use a word like shockwave, I think people are going to think, and especially if it gets deep into the tissue, the muscles, they're going to say, does it hurt?
Exactly. Great question, Linda.
Yeah, well, I can answer that. It definitely doesn't hurt. And Stacey was really good saying, say 1 from 10, what's your pain level? And mine was always a 1. Most of the time, I didn't really feel anything. But the good thing is that if you felt a little bit of discomfort, you knew that it was working because it could find the part in your body that's inflamed. And so definitely on my very tightness part, the machine does this little clicking, and I could feel a little discomfort, but it still was a 1 pain level. And then I knew that it was at least finding something to work at. So,
yeah,
well, those are the right terms, Stacey.
Yeah, absolutely. Yeah, and a lot of people have a sensitivity that's somewhere between 3 and 6, but they're always in control. If it's too much, I turn it down. If it's not enough, they tell me to turn it up. I turn it up. So the person that's being treated is always the one in control.
That's fantastic. We're running out of time, but I just want to know really quickly, are there other tools in your toolbox that you can use if maybe the Softwave technology, you make strides with it, but there's still maybe more? Are there other things you can try?
Absolutely. So we do manual therapy, like I talked about. So that's Softwave allows me to do the manual therapy more effectively. That's basically putting my hands on the person, getting into the muscle or addressing the joint issue that they have. We have other modalities that we can utilize as well too, but usually it's the Shockwave or Softwave and the manual therapy, plus then some exercises to help with stability and addressing any triggers that might be causing the pain. We address those, and that's usually what helps people get the long-term relief.
That's so great. Linda, I'm excited for you. Congratulations on being pain-free. Stacy, it's always great talking to you. Thank you so much for sharing more on this therapy.